Hi, my name is Paul Secor, and I'm the Vice President for Philanthropy for the Mental Health Association of Central Florida. And one of the things we do at our organization is host a program called Coping Together, which is designed to tackle different issues in the mental health space. Right now, it is Hispanic Heritage Month from September 15th to October 15th. So we thought it'd be great to take a deep dive and explore mental health as it relates to the Hispanic community. I'm joined with three of my colleagues today. And if you can each introduce yourself, tell us your name, where you're born, and then also what you do at MHACF. So Lisette, we can start with you.
Yes, Paul. Hi, my name is Lisette Rusa. I'm the Vice President of Operations for the Mental Health Association of Central Florida. I was born in Barranquilla, Colombia. I've been in the United States for a little bit over 30 years. And like I said, I'm the Vice President of Operations for the organization.
All right, Elizabeth.
Hello, my name is Elizabeth Cruz. I am the Director of Outpatient Services here at the Mental Health Association of Central Florida, and I was born in Puebla, Mexico.
All right, and what do you do at MHACF?
The Director of Outpatient Services. I oversee our Connections Program and our Outlook Clinic.
Okay, and Ivan.
Hi, my name is Ivan Diaz Barrios. I was born in Puerto Rico, Humacao, Puerto Rico, and I've been living here in USA for more than 25 years. I'm the Community Care Manager for the Mental Health Association of Central Florida, and I work with teenagers, youth, the parents, caregivers, and the family. We provide free mental health services for them, including individual and family therapy as well.
All right, this is great. So we have a panel with two different countries and one U.S. territory here today. So y'all have different experiences. One thing we'd like to start out with is what motivated you to get involved in the mental health industry? What inspired you? Because it's a very unique field. So Lisette, if you can start and tell us about why you got involved in mental health.
Yes, of course, Paul. So I started in mental health field a little bit about 20 years ago. But all my life since I was a little girl, I've been drawn to psychology and understanding behaviors of other human beings. And it has been in my family per se, and the influence of my family as well to get into the field. I've always been drawn to by friends and colleagues and family members that come to me for advice, they just come for me to listen to their problems. So it was already ingrained in me since I was a little girl. And arriving to the United States, I saw the need more than anything in our Hispanic community. And helping the Hispanic community, the immigrants coming into this country, was one of the things that really pushed me to get into the field.
Okay. So kind of like you're the go-to person when someone has a problem, they talk to you. And so you kind of expanded that into a whole career.
Yes, I have grown into that even until this day as a Vice President of Operations for the organization. My team members come to me for everything. So even though I currently don't practice, I'm more in a leadership role, I still feel that I do that on an everyday basis.
Okay. And Elizabeth, what drew you to mental health?
I was fascinated by human behavior, the research and studies that I started learning in school, just the interventions that are used, how that affects human behavior and can improve their lives.
Okay. And Ivan, I know you have a long history in mental health as well, and you've done mental health work here in the continental U.S., but also in Puerto Rico. What got you started in the industry?
So I started at a very early young age. I was 6 years old when I started as a minister, working with people in the church community. And from there, growing up and just following studies, when I turned 12, the interest of pursuing a career in mental health, specifically social work, it was in my veins already. So I enjoy working with people, identifying their needs and solutions, presenting solutions that they could explore for those needs, and just working with the community moving forward with them. And it is a satisfaction that you feel after when you look back and you see the results and the outcomes.
It's interesting. Each of you, this has been your career from your start of your collegiate time in academics all the way to now. Like, you haven't had any career changes. Each of you has been in mental health since you started, right?
Yes.
Yes.
So
Wow.
it's been more than 30 years.
Whoa, okay. And you started when you were 5, right?
I was 6. Yeah, I
You're
was
6.
6.
There you go. All right. So one of the things, this is Hispanic Heritage Month, and we have a lot of programs and information focused on serving the Hispanic community. You know, the Mental Health Association of Central Florida, we produce quite a bit of content in Spanish. We go to special presentation for different Hispanic groups. Why is it so important, do you think, to target and niche down to the Hispanic community? I know, Lisette, you mentioned that you had some experience with immigration and new immigrants coming to this country and some of the challenges they face. Can you expand upon that and tell us what mental health is all about when it comes to the Hispanic culture?
So yeah, Paul, I would actually share with you that when I arrived to the United States, I was 9 years old, maybe 10. Um, I'd encounter a lot of changes that I had to get used to. You know, it's a new culture, a new way of living, new people, new processes. It's a new life altogether. And as a 9-year-old, you know, you just do what your parents tell you to do, right? And you come to a new country and you just gotta settle. And thank God, for me, it was an easy process and I was able to do it. I learned the language and learned the processes and the culture, and I was able to adjust, having the support of my parents. Yet it would have been ideal if I knew then, or if my parents knew then, what I know now, which is the mental health resources that are there in the community to assist those children coming from another country to adjust to a new culture. They do have struggles. I know that the kids that came in of my same age when I was arriving to this country went into different problems in school, behavior issues, defiant behaviors, you know, not doing good in school. And that whole situation had to do with not knowing the language, you know, not feeling connected with the community because it's completely different from where they come from, not having that support system. And sometimes you think the parents that's enough, but no, you need that professional assistance, that professional help. As I started my career in mental health, I realized that we were able to help those children with just something simple as an adjustment disorder. It's just the part of the moment that they're adjusting to this new culture, and seeking that professional help really helped these kids in getting into a new life and behaving in school and understanding what was going on in their life and being able to succeed. But there was a lot of children that didn't make it, that they, you know, got into substance use or into bad habits just because they were struggling with those behaviors and struggling with those changes, struggling to adjust. Not everybody adjusts the same. Not every child has the same amount of resilience. And I feel that that is really important for the parents to understand, that you need to seek help. Mental health is not just for the crazy. You know, it's mental wellness. It's just like having a headache, having a stomach ache. When you have all those symptoms, they could be anxiety provoked because of anxiety, or because of depression. And understanding those things are important. So I feel that we have to educate our community a lot more, especially the Hispanic community, on why those services are important, for not only for them, for their children as well.
Yeah, that's a great point, because I think immigrant parents have so much on their plate already, trying to, you know, adopt to the new culture themselves, trying to make sure they have enough of a living to support the family, do all those things, move to the country, get established. And now it's like, I guess for their child, they feel like they've done all of this for their child already. Now the child, all they have to do is complete school, but completing school is a culture shock to them as well.
Exactly. It's completely different and difficult. And in my case, for example, I was the go-to for everything because I was the one that learned the language, and I had to learn it really quick so I could assist my parents in communicating out there. And, you know, so I grew up, or matured, I should say, at a very, very young age because of that. And not every child is the same. So having that support is really important for them.
All right. So Elizabeth, I think Lisette took a really good deep dive into the challenges that immigrants face in the U.S. When it comes to mental health. What's your perspective when it comes overall to the Hispanic culture? Why is this important that we introduce this conversation and we make sure people understand what services are available?
I think it's just that the idea of mental health even existing, most Hispanics don't even recognize that being depressed or anxious is actually a health issue. They see it as, I know I've been told, oh, if you're sad or you feel depressed, you're just being lazy. You just need something else to do. If you're worried, worry about getting your chores done, worry about school, don't worry about the future, don't worry about why don't you just stop worrying about it? We have phrases that is like that is supposed to encourage and motivate you to keep going, but it really is used to shut you down and say, stop thinking about it and just ponte las pilas, just start, keep going, keep on going. And I think our culture needs to be educated and learn that mental health is a health issue. It might not be considered a physical at this moment, but it is something that affects themselves, the adults and the youth. And being able to recognize that that is an actual health issue can help then the parents and the children to seek the services that are out there and not be afraid to speak up about their feelings or about what they're going through, or if they're the challenges that they're going through.
Yeah, that's a really interesting concept there, because it sounds like in one way the culture is pushing the idea of mental health resilience, right?
Mm-hmm.
Like, don't let it bother you, don't let it inhibit you. But at the same time, it's not taking the time to pause and acknowledge or validate things that people might be going through. That seems like a tough line to walk. How do you walk that and introduce that culturally on both sides and make sure people are being mentally resilient, but at the same time acknowledging things? How do you do that?
I think it's just being open to learning about it. At least for me, it's learning that what my feelings are, learning how a counselor can help me, and understanding that it is a partnership with the counselor and myself. It's not a work that just the mental health provider will be doing, but it is the work that I and a mental health provider will be doing. It's to help build that resilience, because sometimes you just need that additional help to build the resilience that your culture is already kind of pushing or your family is pushing. But just like Lisa has said, we're all unique, we're all different. And sometimes we just need that additional help to help us see how to be resilient or just process a situation that we're going through.
So part of resiliency is processing. So I think that's a great key to look at. Ivan, what do you think? What do you think? Why is this important with the Hispanic community beyond what Lisette and Elizabeth have already covered?
So I agree with all my colleagues. It is very important because there's a difference of culture that is impacting not only the emotions, but the brain as well. There's a change of language, there's a change of places, there's a change of people around, there's a change of systems, and we don't have the same system back in our countries. Our countries, some of them, not all of them, has the opportunity to learn the language and study English in some of the countries, but there are countries that they don't have that privilege, that opportunity. So when you come to a new place, a new surrounding, new environment, new system with another language that you don't know, your brain is going to be impacted, your physique is going to be impacted, and your emotions as well. So we encourage our community y nuestra gente que busquen ayuda to seek help, because there's a big difference on all these changes and all the impact, not only for the adults, but for the children as well. So all the family will be like immersing in this whole change, that if you don't look for extra help, you're not going to navigate it by yourself, because there's not knowledge out there about mental health. There's a lot of stigmas in our culture. We don't teach our children to recognize or identify the emotion, to express them. You just stay with them inside. Like we said it in popular vocabulary, suck it in. Don't speak about your emotions. You don't tell anybody your problems.
Exactly.
You don't talk about anybody of our family issues to anybody. So all of that is part of the culture and the learning process. So when we come here and we have an amazing agency like Mental Health Association providing free mental health services to the community for those people that don't have insurance. And we are very open and just waiting for you to reach to us. And we are willing to help in the process. So it's not going to be something that is going to be kept in between the family or quiet, or I have to deal with this emotion and suppress them. That later on will be more difficult to deal with, and mental health conditions will flourish because we are suppressing our emotions. So we don't want that to happen. We want to call it on time and just reach to us, and we're here for you. We're here to help and assist you. Just identify your emotions, how you feel, your thoughts, your ideas, and put it to work together. And we work the path with you.
Gotcha. Now, one of the things I really want to explore, because it's a curiosity of mine, and I think if we're really serious about this, we need to start talking about causes and the root source of the issue, right? And so one of the things that kind of baffles me is you see so many different countries. We have Colombia, we have Mexico, we have the U.S. territory of Puerto Rico, we have all kinds of Latin America countries. I don't know, there seem to be 20, 30 plus Latin American countries, right, or Hispanic countries. But this seems to be a common thread of the stigma having an increased level in the Hispanic community in different cultures within Hispanic countries. What do you think is the root cause of this? How does this persist in so many different ways in so many just different geographic regions? What do you, I guess, Ivan, maybe can you start with that and take that on? I know that's a tough one.
This is going to be my perspective about the stigma with mental health. It has been a generational course, if we can say it like that. So it's been passed generation through generation, not to talk about your emotions, about your feelings. You have to be strong, including if you are male figure. If you are male, you're not allowed to cry. You're not allowed to show your feelings. And if you do it quietly, that nobody's going to see you, nobody's going to hear you crying or just expressing your emotions. So you have to keep it inside. If you are a female, you got to be the strong posture column of the house, and you have to be submitted. You cannot show emotions to your kids because you're going to make them sad. So if you are female, you have to deal and carry everything from the house and the family together, and your role is to keep everything together as a female. So all of that is being passed generation through generation, and it's been a stigma talking about mental health, talking about how I feel, how I think differently than what I was taught. So when you bring that difference, then you are considered out of the norm, out of the family, and plenty of cases you are out of like heritage. So you cannot continue being part of our family. You're not worthy to carry our last name. So dealing with all of that, and trying to delete the stigma of mental health, it is a challenge. However, that challenge is conquered when we open our mind, like Elizabeth said before, just being willing and open to learn. There's a learning process about mental health. We're not gonna know everything at once, but little by little, we could gain more knowledge, more information, and learn how to cope and how to deal with emotions, with feelings, with conditions.
Now, Elizabeth, Ivan brings up an interesting theory on kind of the matriarchal and patriarchal duties and kind of those identities and that being a root cause. Do you have any additional theories on why there might be a greater stigma in the Hispanic community when it comes to mental health?
I think that at least from the population I come from, where money is an issue, they don't have very many needs. My family came from very humble beginnings. Their main focus was basic needs. Their main focus was surviving. So emotions and thinking about what you're going through, it's not helpful. What you need to focus on is, what are you going to do to get food on the table? What are you going to do to make sure your kids are okay? So I feel like a lot of that is the parents just keep like, we have to build resilience. My kids just need to learn to keep going to the next step, focus on getting their basic needs and just surviving. So they haven't had the time to build that awareness in themselves or encourage awareness within their own family, which then within the culture.
Okay. And Lisa, any theories to add, or did Elizabeth and Ivan cover it all?
No, they definitely cover it all, and I am going to move forward to 2024, right?
Okay,
We are
okay.
now in 2024, and I know that they all say it's generational and all, basically focusing on the basic needs and how we were taught, but we need to be that change. And it starts with us, and it starts with my colleagues here, educating our parents, right? Educating them on why this is important and why we do need to acknowledge how we're feeling. And it's also important to create that emotional resilience and that mental health resilience at the same time. Before you said, how do you balance the culture of trying to create resilience in the child, but at the same time acknowledging that there is an issue going on? And I think it's open communication, understanding that it's important to communicate with your children. And back then, you don't talk to your children, the children don't talk to the parents. And so it's that educational piece that has to be constantly done with our ancestors, with our parents, with our grandparents, so that they can understand we need to be the change. Moving forward, it needs to be different. We do need to acknowledge that we do have feelings and things that we have to deal with on a day-to-day basis. But at the same time, yes, it's also important to create that resilience, so that you could and learn how to cope with certain situations in your life. And so it's definitely a balance, but it comes a lot from education and trying to educate the individual. So let's break that cycle, right? Let's break that generational cycle that we've been going through about, okay, that's because of this and that's because of how they were raised. Okay, how can we change it?
So speaking of that, one of the big things when we go to events and different mental health networking things, there is obviously an underrepresentation by Hispanics in terms of professionals and practitioners in the industry. And it seems like that might be one of the issues too for present day is, hey, if you want to increase the number of Hispanic clients accessing these services, we need to have providers that people can identify with, that speak the language in some cases, things like that. So what do you think we can do, Lisette, to increase the number of professionals in the industry? And what would you recommend? Let's say there's a high school student out there watching this, or somebody that's not in the career field but might consider making a career change. What do you tell them if they're Hispanic and they have an interest in this?
I think it's most importantly, follow your heart, follow your passion. When I started in the field, my school counselor at that time in high school, I'm not going to say her name, I'm not going to put her out there.
Let's put her on blast.
But I am sure she'll probably remember. The first thing she said was, you're not going to make any money in psychology. Pick something else. So she completely tried to redirect my interest in what I really wanted to do. And I am in the field that I'm in, and because I love it, because it's passionate for me to be here. And that's why I feel like every day I just come to work and I'm happy to do so and be in the mental health field. So if you're passionate about it, yes, money is important. Yes, we know we'll have all those financial needs, but you're going to feel great at the end that you made a difference, at least one person at a time, one person a day, one person a minute. It makes a difference when you come home and you know that what you did was, you feel satisfactory at the end, that there was a positive outcome for one individual, that you will be able to help one person. Don't get into this field because you had an experience or because you want to get the help that somebody gave you at one point. Trust me, if it's not what you want to do, it may drain you at the end. So you have to be passionate for what you do. That's just my simple advice.
Yeah, it seems to be an intense field, right? It gives a lot emotionally in terms of the reward, but it sucks a lot out too in terms of providing that resource. So Elizabeth, I know that you work with a lot of young people because you manage the Connections program, which is staffed by a whole host of interns. What do you tell your interns who want to pursue this as a career? What's your advice to them, and especially getting more Hispanic students involved in this?
Really, I think it's back to what Lisette said. If they're passionate about working with other people, helping them out, then they'll have the patience and the desire to continue in this field. It does take a lot from you, like Lisa and you said, and you have to be willing to put in the effort that it's going to require, and be willing to do that extra step for that individual or find them that extra resource. So just as long as you're passionate about helping your community, helping others, then this is the right field for you. Now, psychology has many other ways that you can get involved. It doesn't just have to be counseling. It doesn't just have to be social work, but there's also research that can be done. A lot of research that can help us better understand, different cultures and how we can assist them with different interventions, understanding why certain interventions work for these populations versus others. So the mental health field has a lot of other fields. So if you are passionate about getting into this field, also know that there's other ways you can be, you can influence and make changes, especially making the change in the stigma, getting in this field.
That's a great point, because I think a lot of people just assume that mental health is going to be one-on-one counseling, sitting down, delivering therapy to somebody. But it's just like when you watch TV, there's not just actors, there's people that are behind the cameras, there's script writers, there's editors, there's producers. So you're saying the same thing about mental health industry, is it's broad in the types of things that you can do. Yep. Okay.
Yeah.
All right. Ivan, anything to add in terms of how we can get more Hispanic representation in this field, especially with young people or people looking to make a career change?
The behavioral and mental health field is very wide, and there's space for everybody in here. And we like to encourage those that are pursuing a career or studying for any of the professions out there for mental health or behavioral. My advice would be to look inside for your skills, your strengths, and your weakness. Use your strengths to strengthen your weaknesses, and then identify those skills and abilities that you possess. Make them your pillar, your column, your anchor to just stand for yourself and fight for the career. There's a lot of challenges when you finish studies, like getting your certifications, specializations, getting your license, registration. So those challenges will be arising after you finish your studies. Make that consideration just to move forward, not to discourage anybody, but to encourage them to be more serious about the profession and the career. Because we're dealing with people, we're dealing with mental issues, and we have to do it in a proper way. So each state in the United States have their own regulations for each profession. So that's why we encourage and keep telling you, you have to look for your witness, your passion, whatever you want to create as your career. Just use it, your experience, past situations that you have in your life, and create that strength and that passion for the profession. So just move forward and pursue.
Wow, I've heard, if I could do a word count in passion, I think I've heard that the most in our whole conversation.
Yes,
so
yes.
you want to get involved in this industry,
We
make sure you
need
get
it.
passion and follow your passion.
Yes.
All right. So Lizette, I know you're a big advocate on let's move off of yesterday, turn the page, and be about today. And one of the things I think is people don't understand all the different services that the Mental Health Association of Central Florida provides. And the fact that we do have some content in Spanish. And the great thing is that we have 3 Spanish speakers on staff. The only reason we're not speaking Spanish today is because of me, which is fine. And but what kind of services does our Hispanic community, can they access when they look at the Mental Health Association of Central Florida?
So Paul, when I started the Mental Association of Central Florida 2 years ago, I was amazed at all the services that we provide that are free to the community. Did you hear that? They're free to the community, and that we work with individuals with no insurance, no questions asked. So I was in awe. I'm like, why isn't my community, my people tapping into these services that we provide? We have a clinic that does counseling and psychiatric services for the uninsured for as young as 6 years old and older. We have our Reflections program, which is peer-led support groups. And one of them is for women in Spanish. So, and that I lead that group, you know, so anybody that wants to come into the group is once a month. And you don't have to have an issue, just want to talk to somebody, you could join that group. It's online, you don't have to drive anywhere. We also have our connections program where we do a personalized search of all the resources in the community. You could just give us a call. I always said every time I'm describing this program, it's like having a personal assistant, because I wish I had somebody that I could call and say, hey, I have Florida Blue as an insurance and I'm looking for a gynecologist. Can you help me? You know, because I don't have to do that legwork. We do the legwork for the individual. We do a personalized search in our database of over 3,000 providers, not only for mental health, but also, you know, any financial needs, housing, food, legal assistance, you name it. We have our family advocacy program that is run by Ivan, where we provide workshops for parents as parents, parenting skills. We do a lot of different programs in case management for the family and the individuals to help them in any needs that they have. He also does our counseling piece for the youth and family services. So for those youth that are in need of services that don't have insurance, you know, and he's Spanish speaking, that are immigrants just coming to this country, there's no questions asked. Just reach out to us and we're able to provide that service to you if you don't have insurance. And again, all of our services are completely free.
That's
I don't know
right.
if I missed any of our programs.
The Guardian Advocate,
What was it, Ivan?
the Guardian Advocate program.
Oh, Guardian Advocate. Yes.
The Guardian Advocate program is our certificate course that we provide to the community, individuals in the community that are willing to volunteer with us for those individuals that had been Baker Acted. And if you don't know what Baker Act is when you are institutionalized either voluntarily or involuntarily with a mental health crisis. And if you're there and you don't have the support system in the facility or you can't advocate for yourself, they contact us and we're able to assign them with a guardian advocate during the time that they're at the facility.
All right. Well, we
I
got a
would
lot of
like
great
to
programs.
add,
Oh, and
I
Ivan,
would
you got
like
more.
to add that our agency has a suicidal program campaign running right now. And if you want to or you would like to pledge the lead, just contact Paul and he will give you the information.
That's right. So I'll take the opportunity to plug two websites. So anyone looking to get connected with our services, it's mhacf.org. It's mhacf.org. And if you would like to get involved in our suicide prevention program, it's youaralifeguard.org. That's youaralifeguard.org. In two great resources that are completely free. All the services we provide under each one are completely free. And wow, I feel like we've covered a lot of ground today. I want to thank each of you for being here. Thank you, Lisette. Thank you, Elizabeth. Thank you, Ivan. I think, you know, our commitment is this is just not, you know, it's Hispanic Heritage Month, but it's not just one month that we're about serving the Hispanic community. This is something we're focused on year round. So if you have a need, if you'd like to get a presentation at your organization, your school, your business, you'd like it in Spanish, or you'd like it focused on the Hispanic community, or you need resources and you'd like to speak to someone in Spanish, we have that as well. And we're here in just general to support people. So did I miss anything, team?
No, thank you, Paul. We appreciate that you did this and that you took a crazy idea and made it into a reality. So thank you very much.
Absolutely. Well, thank you to
Great
each one of you. I
conversation.
think we had a great conversation here today. And I look
Yes,
forward to
I agree.
continuing this and promoting more opportunities to this organization. Thank you for tuning in, everybody. This has been Coping Together from the Mental Health Association of Central Florida.